Thank you so much, Dr. Ankita Saigal Sharma, for your insightful talk. Your valuable perspective on nutrition and metabolic health was truly enlightening for all of us.
Our next speaker is Dr. Mahak Sharma, Associate Professor in the Department of Dietetics at Manav Research International Institute of Research and Studies. Dr. Mahak holds a PhD in Clinical Nutrition from the University of Delhi. Today she will discuss chrononutrition and gut health, an emerging paradigm in the prevention of non-communicable disease. Please welcome Dr. Mahak Sharma.
A very good morning, everyone. I'm Dr. Mahak Sharma. I'm professor now in the Department of Nutrition and Dietetics. And I'm very thankful to Carcon because it's my third year with them. And I always love to be here at Varanasi because it always gives an immense pleasure to be in the land of Shiv Lord and Lord Shiva. So today I'm going to talk on something which is very, very new and very, very different. My colleague, Dr. Ankita, has talked about all the nutrition perspective, but I'm going to talk to you about the meal pattern because now there is a paradigm shift towards the eating pattern. It is not about only eating food, but how you eat food that matters the most. And it has a strong connection with obesity, diabetes, CBT, and the theme which we are working with. Chrononutrition has come from the Latin word. It's a very new word. Many few people have heard about it. Many few research has been done. This word has introduced in 2020 when they started with the questionnaire where they talked that chrononutrition becomes a more important part. So it's a very new terminology. It is basically talks about per day. There is an interrelationship between the meal pattern you consume and the most important is circadian rhythm. Now we are talking about clock of our body, which is usually, there is 3 kinds of chronotypes which I'm going to talk about, but that is the main connection. And that leads to development of many hormones, enzymes, digestive system in our body. So if my chronotype is correct, I will not develop or will not develop any kind of metabolic conditions. That is the theory behind it. Although we are nutritionists, we are following it from about 15 years without knowing this term. So we always tell patients to eat after every 2.5 hours so that this rhythm can develop. The main component is it is used for optimum digestion, energy balance, and nutrient utilization. It works with your liver. It works with your glucose metabolism. It works with the lipid metabolism, as well as gut. Very, very important because now gut is our second brain. Everybody is talking about it from past 2 years. So all these are connected together if you have a good circadian rhythm. That is the main focus now from nutrition perspective. What we emphasize is what you should eat. That is very, very important, which Ankita ma'am has beautifully stated. What you should eat. But what about at what time you should eat? That is again an important parameter to look at because there are many fad diets coming in the market. I hope everybody has heard about intermittent fasting. There are celebrities defining intermittent fasting as a healthy fasting diet. It is not correct. It is not connected with the circadian rhythm. There are keto diets. There are many other fad diets. Vegan diet is coming in the market. Gluten-free diet for weight loss, because you don't want to fall into the obesity trap. So there is lot of changes going on in the scientific world, and it is directly connected with your microbial gut parameter. During the daylight, what is the fundamental reason behind it? That during the daylight, we always have a better and excellent digestive system. The BMR is very, very high during the daylight. And when it's go to the evening side, in the night time, it is reducing. There's a reduction in the digestive system, there is reduction in the BMI, there is reduction in every parameter, and that's what it says about cardiac rhythm. That in the morning when you wake up, the sunlight, and you sleep at night, the sun is going down, your metabolism is also going down. And it follows with the yoga perspective too. The recent study stated that when you eat late at night, the meals, so So when you're eating after 11 o'clock, this is one of the study being done in 2023. If you sleep at night, eat food after 11 o'clock or 12 o'clock, what will happen? It will increase your abdominal obesity, it will increase your fasting blood glucose, it will also increase your lipid profile. And the mechanism behind is this. This is one of the papers we have published in 2025, and this paper talks about chrononutrition. There are no very limited studies on that. It is a Scopus Index Q1 journal when the paper got published. This states, now listen to it very carefully because it's very, very interesting. When I wake up in the morning, my eyes wake up, the light falls in my eyes. That activates my genes. That activates my SCN system. And this is present in my hypothalamus. It activates and it starts producing, or it gives signals to my clock and BMLI. This clock and BMLI further gives indications to my genes, purr and cry. They give indications to my genes that this is circle, if you can see, the purr and cry. They start producing from the nucleus and enters into cytosol. And from there, the metabolism of glucose, metabolism of lipid, metabolism of BMR, everything generates. They give signals to my liver, to my pancreas, and to other parts of the bodies to activate. Once, they are very, very active in the morning hours. But once the night time starts, this is a standard physiology. Once the night times fall, evening time comes, these cry and purr. They combine together, make a complex, and enter into the nucleus back again. And that nucleus gets filled. That nucleus gets filled. Once you sleep, this nucleus having lot of, this is the one with genes which activates my system at night. So my involuntary muscles are working, my heart is working, my kidney is working, my lungs is working, everything is working. The body is asleep, the body is in the resting phase, but my every organ is working. So these nucleus genes, they get empty and they give indication to maintain your metabolism at night. In the morning, they get, when you wake up in the morning, they are again empty, they again produce, same process follows, and again the same thing follows. What happens when you sleep late at night? They still remain in the nucleus but cannot be activated because you are not sleeping. So my metabolism falls down. My every parameters falls down. So there we are focusing on this part that we have to sleep at a particular time. That is my body's rhythm is asking for because all my metabolism is changing. It is not only controlling your hormones like melatonin at night, it produces leptin at night, cortisol in the morning, as well as ghrelin when you're eating food. But it is also controlling your peripheral clock. The peripheral clocks which talk about pancreas, liver, even adipose tissues. If you eat at night or there is misalignment in your sleeping pattern or waking up pattern, it increases your insulin level, increases your blood glucose level, increases your lipid profile. Just by not sleeping at night and in the morning, you're not waking at a particular time. That is what it do. And there are scientific studies, hypothetical studies which are working on it. Very few research papers being published on it nowadays. And we are moving towards that era that we will going to work on it. Why it is happening? Because my pancreas is not allowed to work at night. My pancreas is on the sleeping stage. You are forcing your pancreas to produce insulin at night so that you can digest your food. Because you have eaten late night. And that's why if you connect, all late night eaters have the obesity parameter. And we did it in one of our master studies also. And I can show you the correlation too. Chronotype, there are 3 major chronotypes which affect control your cortisol level, body temperature, eating habits, cognitive ability, sleep cycle, every parameter. These are 3: morning, intermediate, and evening. The difference between the 3 is only 1 hour. So if you look at the morning chronotype, the wake-up time is 5 to 6. Whereas in the intermediate chronotype, it is 7 to 8. And the last one is evening, which is basically 9 to 11. But out of these 3, the best one is intermediate. You should wake up at between 7 to 8 o'clock. Why? Because energy metabolism goes on till 1 o'clock, 2 o'clock. So your performance with excellence during that duration. Whereas if you wake up in the morning at 6 to 10, if you see the study, 6 o'clock, the early morning, 6 to 10 is the peak time where you do all your activities with excellent performance. So you might take in your breakfast at time, but your lunch time is not at 10 o'clock. Your lunch time is at 12 o'clock or 12:30 or even 1 sometimes. So what will happen? The digestion will slow down. Okay, that's what it's indicating. Third is evening time, which is the worst time, because once you wake up late, it will also late up your digestion system, and when you will eat more at night, and my body is not active at that time. So that's how it works. Now we did it with one of my PhDs, my master's students. It's all a very simple, small sample because it was a master's program. So we did it on 100 sample, 100 obese and 100 normal patients. And what we realized that those who were waking up at morning at 5 to 6, they were more obese than compared to those who were waking up at 7 to 8, as compared to normal. Although this study is very small, it's not a very significant study, I should say, but there are no studies been done till now for these parameters. So we can work on 1,000 sample and look at the connection between your wake-up time as well as your eating pattern as well as your obesity level. So we can take care of this part. Out of those obese also we categorized that they were more obese. Second obese 2 types. Those who were in the morning hours wake up. Because the reason why it is happening, because the energy dose goes down at 10 o'clock. So when they are in the college time, they are not having enough energy to understand the whatever they are learning in the classes. So that what it predicts, but right now this is not a justified sample, I should say. There is more studies need to be done to get an answer like that. This is what we have realized, that those who have big eating windows, they will also have chances of getting more obesity. So if I have a 12 hours eating windows, 11 hours eating windows, even from breakfast to lunch, some people has 5 hours eating windows, 6 hour eating windows, they are moving towards more obesity than those who are eating every 2.5 hours. So there are many doctors who say, itna sara zarur khana ki zarurat hai. Many people come to us, itna zyada khana padega. And then we tell them, when you eat that much, you will going to lose much more faster, because my metabolism works like that. So eating within 2.5 hours, every meal, it is not a heavy meal, small and frequent meals will give you better perspective towards the obesity. You will lose much more faster, and we have patients like that. We did 3 months intervention with Manav Rachna employees only, and we have realized a wonderful change in their obesity percentage. Some of them have lost even 10% weight and retain their muscles, because most of the time when you lose weight, muscle also get lost during that process. But retainment of lean muscle mass was there, and there was reduction of 10% weight loss in many patients. So that's what we are focusing on. This was been one of the validated tool, Chrononutrition profile tool, which has been used to do this study. It has been published in 2020. Then dysbiosis. So how it is connected with gut. So we all know what is dysbiosis. We know that micronutrients affects by the food or eating habits. So for example, when Ankita ma'am talked about complex carbohydrate like prebiotics, which is your basically salads, vegetables, they all controls my gut. So they are prebiotic, they get into your gut, converts into acetates, converts into propionates, and produce probiotics, which further controls my internal lipid profile. They control the lipid profile or endogenous production of LDL. So all these parameters are connected with gut. Now, what is the theory proposed that when I don't sleep at a particular time, if I don't have a regular eating pattern, this gut get impaired, and then you have a leaky gut component. You feel diarrhea every time, you feel anxiety every time, and that is because of this situation, which leads to many gastric problems. I'm so sorry, just 2 minutes more. So I'm going to skip this part because I want to show you this theory. There are 2 major theories which are coming in the market regarding this. If I have an irregular sleeping pattern, if I'm not sleeping at night, if I'm not eating at a particular time, it changes my beta-catenin. The beta-catenin is a protein which basically tightens my intestine muscles, and then we'll develop a leaky gut. This is a very important theory, and this further leads to condition of gastrointestinal diseases, further leads to condition of CVD and many more, because gut is now connected with every organ. So this is one of the theory which is very, very important. The second theory is social jet lag. Very, very interesting. Once in the weekdays, you are going on a particular timing because you have to go to the office, you have to go to school, you have to go to college. But when it's weekdays, weekends, you sleep late at night, you wake up early in the morning because you want to enjoy those 2 days. But that is actually changing your gut microflora. That is crossing pro-inflammatory markers, increasing inflammation in the body, as well as changing the production of good bacteria in the body, and further leads to decrease your microbial diversity. This is very, very interesting, and no study has been done on this. This is a very big gap, and I am planning to work on this with my PhD scholars. Amazing work, and this further leads to a condition like obesity, diabetes, heart conditions, and many components. So if I control this part, I can control every parameter, like nutrition. So nutrition and chrononutrition should combine together to work on this with, I believe, with all diabetologists. Because there comes the role of physiology and nutrition coming together. Plus, time restriction feeding has given some information on it, but not been published in a larger scale. They say time restrict feeding can be done, but time restrict feeding is also different from different times. Like it's not that same model is applied everywhere. There are different models applied in every paper. So one of the model which I use with my patients is out of 5 days, 2 days, you take any one meal, which is a major meal, either breakfast, lunch or dinner, what you love the most. And the rest meal, don't break the cycle. Eat after every 2.5 hours, but take one fruit, take one glass of buttermilk, take one glass of milk, but don't break that 2.5 hour rules. And we have seen people losing weight and getting non-inflammatory, anti-inflammatory properties. Another with gut, there are many patients who are, they say that milk should not be given. Many doctors, many patients come to us, we say milk should be avoided. Milk is causing inflammation. Other components should be avoided. This is not like that. I've treated many patients in UK, US, even in India, where you need to change only 3 parameters. 1, mechanical, 2, chemical, and 3 is thermal. Mechanical, all fruits and vegetables raw should not be consumed. Chemical, all masaledar cheeses, spices should be removed. And the 3rd is thermal. You have to give them cold things. You have to give them normal temperature things so that the gut can heal, inflammation can reduce. And you will see patients who are on anti-inflammatory, the drugs which you consume, antacids. The doctor said, you cannot live without antacids, and you cannot imagine within a week the patient is not taking antacids and maintaining a healthy life for the next 3 years. So that much difference can diet do. So I believe that nutritionists and doctors should work together so that we can have a better humans out in the future life. Thank you so much for your time. Thank you so much.
Thank you, Doctor.
Yes, sir. Thank you so much. So that's a wonderful question. One thing, very, very important, please don't send patients with stating, please lose 5 kg weight loss, 5% weight loss. No, don't send them like this, because they will say, they will come to us and they'll say, we want 5% weight loss. I don't care what diet you give me. I don't care. I just want to lose 5%. That is not the way. Please send them to us stating, please talk to the nutritionist. You need to lose 5% with a healthy weight loss. Very, very important. It's very difficult for us to convince the patient because, again, doctor is like God, and it is true. But somewhere we need to work together. So this is the first important part. Second, tell them to eat after every small meal, 2.5 hours meal. Don't eat in between those 2.5 hours. Eat after every 2.5 hours of meal so that your metabolism remains high and you start losing weight. Yes, sir.
Thanks for an excellent lecture. I'll make a very small comment. I agree with you that late night eating is bad, But if you consider the psychiatry of this problem, most of the people who wake for the whole night are really depressed people. And most of the depressed people have various kinds of problems. Some of them have financial problems, others have family problems, others have workplace problems. And see, they try to get over these problems and satisfy themselves by means of eating. And the more they eat in the dead of the night, they cause more damage, as you have shown here.
That's very true, sir. That is called as deprivative binge eating. Because you're deprived of some emotions, or you're in the condition of psychological perspective. Yeah, very true, sir. But there are other patients also, sir, who do work whole day. Whole day they're working, they don't have time to eat. And suddenly they feel like, I want to eat something. Why it is happening? I have consulted many doctors. You cannot imagine. They tell us, Mahak ma'am, I'm a gynecologist. I don't have time because I have a surgery to go during that time. What should I do? So I tell them, okay, what you do, keep your nuts in your pocket. Small nuts packet in your pocket and put it in your mouth after 2.5 hours. You are running, just put it in your mouth, so that you will not feel hungry during a surgery or even after doing that. So we are very right, sir. So that eating span is becoming bigger and bigger day by day, and that eating span is reducing my BMR, reducing my metabolism rate. You cannot imagine, sir, 1100. 900 is the BMR of the doctors. 900 is nothing. So 900, if they eat beyond 900, they will get obese, because they have changed their BMR pattern because of the eating pattern. Yes, sir.
Now the other thing is, I'll make a very small comment. Some of our professions are killing us. There are many young people who do night shifts
Yes.
because of call centers. Others have their links to USA and other places where there's a 12-hour shift between the clock here and the clock there. You know, the whole biological system,
Changes.
including the suprachiasmatic nucleus, gets blocked. You know, they may be earning a lot of money, but really they are killing themselves.
Very true, sir. So we are planning, because me and we professors were talking about it, we're planning to do a nutrition intervention on them also. We are planning to do that. One of Dr. Divya, who's the next talker, she is working, she's planning to work with a PhD scholar to change the chrononutrition type of those patients so that we can have a healthy diet model for them. So very, very true point, sir. And we are planning to work on it. So this is a very new topic. So I thought that everybody should know about it. But thank you so much for your comments, sir. Thank you so much. Thank you all.